Welcome back to the Original Medicine Podcast. I'm MG McCullough, and today we're going to be talking about whether acupuncture actually requires needles. Now, this may sound like a very strange question to ask, and why in the world would an acupuncturist be talking about it? But what we're getting into today is remote treatments. These are treatments that do not use needles and don't require two people to be in the same place even. So buckle up, let's get into it. So many thousands of years ago when acupuncture was practiced, needles were not actually used. It was a more shamanistic form of the medicine, and needles came much later. So in the beginning, we were using our minds and our intention to activate the channel to help other people. So figuring out what another person needs, what channel is affected, a little out of alignment, et cetera, et cetera. We activate that channel in ourselves and then we transmit it to another person. That's how the medicine was originally practiced. And then, as I've said before, I'm not very good at history and historical like timelines, but many years later, needles became the tool with which to focus the intention. So even in the office, if somebody comes to me and they say, I really don't like needles, but I really need help with something. Okay, we don't have to use needles. Of course, there are other tools that we have available to us, like gua sha, which is scraping. In my practice, I just use a soup spoon to do that, but some people use all kinds of beautiful stone. Back in the day, it was like animal bone. But anyway, different practitioners use different things to use gua sha to scrape. We can use cupping. We can use moxa, which is the herb mugwort, and it's rolled into a stick, and then we burn it and we use it to amplify the function of a point. So one distinction, this is a little bit of a dog leg, but one distinction about classical Chinese medicine versus modern acupuncture is that we in classical medicine are not thinking about the actual points quite as much as in the modern practice. We're thinking about the entire channel. And so again, like in the remote treatment, when we are activating that channel, it's not a specific point that we're thinking about. We're thinking about the energy of that channel, which is why this is not really a thing in modern acupuncture, because that's not how modern acupuncturists are trained. That's not how they think. So that is like an important distinction to make. We in classical medicine are offering remote treatments when we can embody the energy of those channels and it is meaningful to us first, then we can transfer it to you and then people get incredible results. So moving on, let me tell you about how it got started, or how it got started for me and how I got into it, and sort of like the whole background. And here we go. Let me give you a little bit of the background about remote treatments and how I got started into it. Back in 2018, my teacher, Ann Cecil Sturman, used to run a class, so to speak, online called Ann Chat. And it was every 2 weeks, and a bunch of us from around the world joined in and we would discuss patient cases. People would ask their questions as they were studying on their own, or questions regarding people that they were working with in their offices, things that were stumping them. It was an incredible learning opportunity. I think it really taught me how to think about things versus what to think. And that was really critical to my learning. Fast forward a bit, a couple of years into COVID, Anne practices in New York. She was practicing there at the time in person, and their lockdowns during COVID were pretty significant and no one could come into the office. So some of her patients reached out to her and asked, would you consider doing remote treatments? So this would be energy work. Like, people are familiar with Reiki, for example, but this isn't as commonplace within Chinese medicine. But anyhow, her patients reached out to her and asked about it. And she said that it took her a minute to wrap her mind around it. And then she said, let's do it. The feedback from her patients was incredible. And what they said was, I never want to come back into the office for an actual in-person treatment because I'm able to feel the treatment so strongly. I'm able to rest longer, like staying in my home. And overall, I just feel that it's a better experience. So this grew from there. And then Anne taught us about remote treatments as she was experiencing it with her patients. So now all of her live classes have some form of transmission, whether that is pulse transmission, where she will have us feel our pulses and then transmit the pulse of a specific channel to us so that we can feel what it feels like. The reason for doing that is also that in a class setting, if you feel a specific thing in a person's pulse and then you tell everyone else to come feel it, oftentimes it changes as it is responding to the individuals, coming one by one to feel the actual pulse. So that's an incredible teaching tool that she does. And then also, like, over the years, from chat to in-person classes, and then when I took her mentorship as well, just solidified for me my ability to receive and give remote treatments. So that was a little bit out of order, but to back up, in late 2019, December of 2019, I and my family moved to Greenville, South Carolina. And this was, of course, right before COVID started. And I was having my own health challenges and was looking for a classical Chinese medicine practitioner because I knew that that's really what I needed and had been injured by TCM acupuncture in the past. So that was just a non-starter for me, and I was not going to go that route at all. And so even though it was hard for me to wrap my mind around the idea of remote acupuncture treatments, I decided to give it a try. I thought, I'll make an appointment. It's just one appointment. If it's not effective, it doesn't feel good to me, I don't have to do it again. That's how I look at most things. So I thought I would give it a shot. I did. And during the treatment, I was lying down as Anne was treating me, and I felt, my eye got teary. So I just reached up to like wipe, like the water that was running from my eye. Like, I was not crying in the sense, it just, my eye watered. And she said she could see me. We were on FaceTime, and she said, what just happened? And I said, well, my eye just watered. And so I just wiped it. And she said, I just needled bladder 1. Now, for those of you who aren't familiar, and if you're listening to the podcast versus watching on YouTube, you can't see me do this, but bladder 1 is a point right beside your nose, between your nose and your eye itself. So it's very close to the eye. And naturally, sometimes your eye can just water when you get this point needled. So that was really quite amazing for me as my first experience getting a remote treatment. And I just noticed in, the week or so that followed, that I felt as though I had had a treatment with needles. So I was quite blown away. I found this very surprising myself. And then my husband also at the time wanted some acupuncture treatment. So he booked an appointment with her. So we continued to get treated with Anne remotely and just found it to be quite profound. And so then, like, I was hooked in this way of treating people, and I continue to do so today. So that's sort of the background of what it is and then how it got started. And usually I will do treatments on some sort of video call, whether that is FaceTime or like Google Meet. When we sit down, we talk to each other just like we would in the office. What's been going on with you? What brings you in? These are the questions that I typically ask in my practice. If you're new here or like new to this style of practicing, like, I think this is really common in classical Chinese medicine, but I'm obviously speaking for me specifically. I don't use an intake form. I don't find all of the history and the questions to be useful. I think it focuses our attention sometimes even on the wrong thing. And it's not necessary to make a diagnosis because I have pulse diagnosis. Now, when we get to remotes, pulse diagnosis is something that I am still working on developing that skill. And so where I find the diagnostic piece to be is really in the conversation, which is also a part of the diagnostic process. Even when people come into the office and are sitting, face to face with me, I still hear things in what they say that triggers my thought process about the channels that have been affected because of their experiences. In general, I'm looking at a lot of symptoms in people that look like resource depletion or mediumship depletion, but that's only part of the story because we have to figure out what is it that has depleted your mediumship. Was it something in your early life? And so that would be an 8 extraordinary channel. You may have heard me talk about these before, but these channels are basically our blueprint in life. So when those channels are affected early in life, they're just a little bit out of alignment and can set us on a path that is not really for us. And so we develop physical and mental issues, psychological issues as a result of those channels being out of alignment. And I personally believe that this also affects our ability to create mediumship and to rebuild it, because what I've seen through my own experience as a patient, as well as my experience treating other patients, it seems often to me that people, especially with chronic health problems do have a mediumship depletion, but it's because of their early experiences in life. And until we correct that, we can't fully rebuild that mediumship simply by using the divergent channels, which are the channels that deal with holding pathology and latency is the wording that we use in Chinese medicine. This just means like keeping your problem at bay so you don't have any symptoms. As soon as you start having like creaky knees or like joint pain or any of the autoimmunity type symptoms, migraines, certainly menstrual problems can fall in this category sometimes as well. Things like fibroids and ovarian cysts, gallstones, kidney stones, all of that like falls in the divergent territory. But what I've come to see is that that sometimes is affected by a deeper level in specifically in the eight extraordinary. Anyway, I'm getting into the weeds a little bit here, but what I'm trying to explain to you listening is that there are different layers that can be affected in any given presentation. And I don't believe that an intake form actually helps me get to that. And I think it just becomes a distraction. Whereas, like, if we sit down and talk with each other, you're going to tell me what has been bothering you, what is bringing you in. And so we do that in the office, and we do that with remote treatments. The remote treatment, we're on video call usually. I've done them over the phone. I've also done remote treatments when we're not even on the phone together. Someone has made an appointment with me. Maybe it's like even cell service issues. So we had the initial conversation. I knew the treatment that I was going to do, and then we hung up, and then I have done them. I've done this with my teacher, Anne, as well. Like, she's treated me from afar, not when we're even on the phone. It's really quite amazing. Okay, so once we know what we're doing, then I just ask people to get comfortable. And so some people choose to just continue sitting in a chair, just like I am now. You know, they close their eyes, generally speaking, but there's no requirement of how it goes. A lot of people, when they're going to be at their home when we do remote treatment, so they'll go get in their beds or lie on the couch, just wherever you can be comfortable. And then depending on what kind of treatment it is, I just go forward with it, and then we'll check in with them. What are you feeling? What are you experiencing? Oftentimes people will report to me before I even ask. They'll say, oh, I feel like a sense of like a heavy feeling or like a warmness or like heat is moving through my body. Oftentimes that's the case when we're bleeding the low channels, because those are the channels that release a tremendous amount of heat, both energetic and otherwise, because when the lows are holding for so long, that creates stagnation, which will create heat. So then when we release it, the heat is moving through the body to leave. And then that creates felt sense of heat moving through the body, which is really fascinating. Oftentimes people will get cool afterwards, but people have these same experiences with remote treatments as well as when they're in person on my table in my office. So I think that is just really fascinating. Just like in the office, sometimes I'm using sinew channel treatment. So I'll have, when I'm in office, when I'm doing the sinew channel treatments, these are the most active on the patient's part, because I'll have them test the movement. The way I don't want to, again, I don't want to get too into the jargon, but just so that you understand what I'm talking about here, the sinew channels are our most exterior channels. When they are affected, when our energy gets trapped in them, we can have a variety of problems. But just for the sake of this example, it can restrict movement. If they have a difficult time crossing their arm over their body, that is a different sinew channel than if you have difficulty raising your arm straight above your head. And if you had a difficult time crossing or twisting your arm, that would be different from the other two. If it's pulling into your chest, that would be a different sinew channel. So in many cases, people do have multiple sinew channels affected. And so we have to treat multiple. We start at the deepest level, and then we work out. And so I have people test those. And it's really fun and amazing to see in remote treatments when we do this. I have people get up and then test again. Okay, what does that feel like on your shoulder now? What does that feel like on your back when you walk down the stairs, or you pull your knee into your chest? Whatever the case may be, I have them test it with remote treatments, just like I do when they're in office. And it's really quite fascinating to watch it clear and to watch them be amazed and like, oh my gosh, like I don't have any pain anymore. So that just gives you an idea of what happens in the remote treatment. It's literally exactly the same. It's just that we're not in the same place. And I think a tremendous benefit from this is obviously that if you don't have a complement channel practitioner in your area, you can work with someone like myself who uses the complement channels energetically, fully energetically. So before we wrap up today, I want to give you a few examples of things that I have treated remotely. Genuinely, just about everything that I have seen in my office in person, I have seen remotely. I've treated people all over the world, Australia, England, all across the country. I'm trying to think if there are any other countries, but like right now I'm working with a patient. I just wrapped up with a patient in Tennessee. I have a patient in Maine and I have a patient in England right now. It's really quite fascinating. And again, such a good opportunity when you don't have somebody in your area. But another way to think about remote treatments is like, what if you are too sick to travel? I had a patient in New York who I could have easily referred to my colleague in person, but this person had hyperemesis gravidum when you're extremely, extremely sick during pregnancy, where she was needing to get IVs on a pretty weekly basis because she was vomiting literally everything. And the car obviously was making this worse. So to get in the car and travel to an acupuncturist in person was not really a good option for her. So this was incredible, like an incredible opportunity for me to be able to help her and her not have to get more sick. But if you think about times where you have been really sick and not wanting to get in the car to go get care, or maybe you're physically injured and it's just very difficult mobility wise, whether that is again due to an injury or like a person maybe later in life who has multiple issues that make it hard for them to travel and move around, remote treatments are a great opportunity for this. So like as I said, the extreme morning sickness that lasted all the time, that was a great help to her and really interesting to see how much she progressed from not needing the IVs to being able to keep more food down. Of course, we still talk about in remote sessions like the diet and lifestyle tips. In her case, mostly it was just diet and trying to support her digestive system while not only while she was pregnant, but also in the presence of such terrible like nausea during your pregnancy. I also have worked with people with all kinds of orthopedic pain, back pain, hip pain, joint pain. I think I've seen the most of that, but also migraines. And then currently, I'm working with someone who is so interesting to me. This is a pediatric patient. And after she got COVID a few years ago, she developed a really heightened sense of smell, and certain things really make her angry. And specifically for her, it's oranges. And she just has like loud outbursts. And then also, along with this heightened sense of smell, she also has a heightened sense of hearing and gets really angry when she hears people chewing or making other mouth noises. And this was something that didn't exist for her prior to COVID. In addition to it just being so enraging, like it's caused a lot of problems in their family because she is just so angry and angered by it that she explodes. Like there are these huge, issues that come out of it. And I saw her for the second time last week, and she said that she had not really noticed a difference after her treatment. And her mom said, "But let me tell you what I've noticed. I have not once heard or seen an outburst in the past week, whereas this was a regular thing before our treatment." And so she said, well, the daughter said, well, that is true. I haven't exploded, but she said, I am still angry when I hear or smell these things. She said, but the difference is that she can say something to the person. Can you please not make that noise with your mouth? Can you please not eat that? There's an ability to deal with what she is feeling that she didn't have before our treatment. And I think that that is such incredible progress for her. And I'm interested to see next week what she says about our second treatment, how it has evolved for her. But also, I share these examples because sometimes people are not thinking about morning sickness as being helped by acupuncture, or something that is so unusual, to in the mainstream world, like a heightened sense of smell or hearing. What would we do for that in the Western medicine world? I'm really not sure. In her case, it was recommended that she get evaluated for a spectrum disorder. And so that's something that they may or may not consider in the future, but they really wanted to look at her holistically and work there. And I think this was just is a really interesting example of what the complement channels are capable of doing. So, you know how everyone at the end of their podcast ask you to go and rate their show, give them a rating, give them a comment, like and share, all that kind of stuff. It really does help us, especially us small little podcasters, get our word out. So if you wouldn't mind, please like and share. Instagram is a great place for us to connect. You can ask questions, and be sure to find this on YouTube as well if you would like to watch rather than just listen. Thank you, guys.